80% already will have gross evidence of coronary disease you can see without a microscope. And there are some of who might say, well, it's the stress of the military. So if we look at a more recent study, in 2000, of those between the ages of 16 and 34 who have died of accidents, homicides, and suicides, the disease is now ubiquitous. Nobody seems to have escaped. Even the 16-year-old woman has the early signs. Now, this is not enough disease yet to carry you off, but you're already building the foundation, and that's sort of important to recognize, that the way we're feeding our youngsters, the way we're feeding them in school, we're already laying, they are going to be the next victims of this disease. 2 years ago, when I was moderating a panel in Los Angeles, Lou Keller was one of the panel members, and Lou Keller is a professor of public health at the University of Pittsburgh School of Medicine. And as a result of his 10-year cardiovascular health study, at that meeting, Lou Keller made the following pronouncement. All males who are 65 and all females who are 70 who have been exposed to the traditional Western diet have cardiovascular disease and should be treated as such. So nobody seems to escape. Now, lest we frighten anybody, how many people here in the audience are over 20? You know, it's always exciting to talk to patients. When we as a profession really blew it was in World War II. I don't know how many of you are out there remember World War II, but it was characteristic that when the Axis power, when the Axis powers of Germany overran the Low Countries of Holland, Belgium, they occupied Denmark and Norway, they took away, for their troops, they took away their cattle, their sheep, their goats, their pigs, their chickens, their turkeys. So largely, these populations were eating plant-based during the war years. Now, let's just look at this a little bit more carefully for a moment. Let's just see what happened in Norway to deaths from heart attack and stroke. If you look over here on the left, 1927, heart disease, strokes, deaths increased. 1930, 35, 36, 7, 8, 9, and then bingo, what happened? In come the Germans. Who knew that they were the greatest public health educators in all of Europe? Immediately there was a plummeting, 1940, 41, 42, 43, 44, 45. If the Germans had stayed any longer, Jeff, you got to hook me up again. If the Germans had stayed any longer, they'd have absolutely finished off all the cardiovascular disease in Scandinavia. However, look what happened immediately with cessation of hostilities in 1945. Back came the meat, back came the dairy, back came the cardiovascular deaths, back came the strokes. How promptly that occurred. Emile Picard, who was the pathologist in Belgium, was telling his students at the autopsy table in 1946 and 47, you see these plaques here? We didn't see these during the war years. Now they're back in that short a time. Pretty profound how powerful is nutrition. Now, the artery on your left is good. The artery on your right is not good. What I'm going to talk about for the next 5 or 6 slides will be the most important thing that I can talk about with you today. This is the muscle part of the artery in the middle, and this tiny little dark area here, one layer thick, are the endothelial cells. This layer of cells are the absolute guardian. They are the life jacket of your blood vessels, as you'll see in a minute. It's amazing how this is the tiniest layer there. This is where it kind of all begins and ends. The endothelial cells, E-N-D-O-T-H-E-L-I-A-L. Let's just avoid the ultrasound for today and look at what happens. When you go down to, gosh, when I was in medical school, there used to be a restaurant in Boston called Jürgen Park. I don't know if it's
Still there.
well, let's just say what happens after a good solid steak and roast beef meal at Jürgen Park. There's certain cellular elements that first thing get sticky within a few minutes after you've eaten. Your endothelial cells get sticky. Your platelets, your clotting factor gets sticky. Your white cells get sticky. Your bad LDL cholesterol molecule gets sticky. And when these things kind of get sticky, bad things begin to happen. We'll avoid that for the moment, but I want you to share with me, this is going to be the toughest that you'll see today. We're going to start on the left. We're going to go over to the right, following these arrows that you see. The blood is flowing up here in the blue area. This is the artery wall. These single layer cells, these purple single layer cells, are your endothelial cells. Remember, when you're 14 years of age, you spread them all out, you could cover 6 or 8 tennis courts. Bring them all together, you've got something the size of your liver. The largest endocrine organ in the body. The endothelial cells. So we're over here on the left. Now you've been to Jürgen Park, and you've got LDL cholesterol got sticky. So did the endothelial cell. We have migration now of your bad LDL cholesterol into the subendothelial space where it becomes oxidized. It becomes oxidized because of this food that we're eating. These free radicals are what oxidize it. Now we've got a nasty particle, the LDL molecule that has been oxidized. The subendothelial space says, I need to get rid of this. They recruit the SWAT team, which are your white cells. And the white cell comes across into the subendothelial space, gobbling up this nasty oxidized LDL cholesterol, until it becomes so chock full that we in medicine do what we do so often so nobody will know what we're saying. We change the name. We now call it the foam cell. The foam cell is truly the Darth Vader of this sequence of events, because the foam cell secretes these nasty metalloproteinases. It's on the test. These metalloproteinases, which have a role that is not so very nice, because these metalloproteinases tend to erode this tiny little